Hello, welcome to my video on chorionic-villi sampling. This is a part of our series called Be Aware, Be Prepared and Be Safe. This is an initiative to enable informed decision making by patients. Chorionic-villi sampling. This is an invasive procedure which is usually performed between 11 to 13 weeks of pregnancy to detect structural chromosomal malformations in the fetus. What kind of problems can CVS diagnose? CVS can identify nearly all chromosomal abnormalities including Down syndrome, trisomy 13, trisomy 18 and sex chromosome problems such as Turner syndrome. The test can diagnose these conditions, but it cannot measure the severity. What factors would put the patient at a higher risk of having a baby with a genetic abnormality or a disorder? This could be because of either an earlier screening test which indicates a chromosomal problem or a patient with previous pregnancy with a chromosomal disorder. There is a history of genetic disorder with either the patient, her partner, or in the family, or if the mother is more than 35 years of age or more. She had previous history of babies with chromosomally affected problems or genetic disorders. When is CVS not recommended? Chorionic-villi sampling is usually not recommended when the patient is having an active infection, when the patient gives a history of prior vaginal bleeding or actively bleeding. The main goal of CVS is to obtain a sample of tiny finger-like projections on the placenta called the chorionic-villi. These villi are sent to the laboratory for analysis. The chorionic-villi are of fetal origin and share the baby's genetic makeup. So it will provide accurate results regarding chromosomal abnormalities. The sample will be extracted through the abdomen. Under ultrasound guidance and after a local anesthetic injection, a long thin needle will be directed to the placenta through the abdomen and it goes through the uterus. The needle then retrieves few portions of chorionic-villi. These cells, after the sample is collected, are sent to the laboratory for analysis. Once the procedure is done, we check for the baby's heartbeat and patient's blood pressure, pulse and breathing. During the procedure, the amniotic sac in which the baby is growing is not disturbed. The procedure takes about 30 to 45 minutes from the start to finish, and the extraction itself takes only few minutes. Some patients might experience some crampy pain or bleeding or spotting soon after the procedure. This test produces a karyotype, which is picture of baby's chromosomes, which provides detailed information about the abnormalities. Chorionic-villi sampling has got up to 98% accuracy. There are 1 to 2% chance of getting an unclear report. It may be called as confined placental mosaicism, in which some of the cell lines which are cultured from the placenta can contain abnormal chromosomes and few of the cell lines can contain normal chromosomes, in which state that we need to confirm it with further testing. In rare cases, the chorionic-villi cells may also have abnormal genetic material even though the baby cell lines are normal. And this is called a false positive result. This would require a confirmatory procedure such as amniocentesis. What are the risks involved? Some of the risks involved with the procedure include bleeding and cramping. Usually these go away within 1 to 2 days post-procedure. Infection. As with any invasive procedure, there is a risk of infection, though this complication occurs very rarely because necessary precautions are already taken prior to the procedure. RH sensitization. During the procedure, there is a chance that the baby's blood may be mixed with the maternal blood. If the patient has RH negative blood group and the father is with RH positive blood group and the baby in turn has RH positive blood group, this will cause the patient's body to produce antibodies. which may attack baby's blood cells. Hence, it is essential for the mother to inform the obstetrician and the fetal medicine consultant prior to the procedure, as in we can administer a medication called Rh immunoglobulin. If the patient is Rh negative, this should be done post-procedure. Accidental abortion or miscarriage. It is often estimated that miscarriages happen 1 in every 200 to 300 procedures. This usually increases if the fetus is of an earlier gestation age. Fetal limb abnormalities. In some cases, CVS affects the baby's limbs like fingers and toes, but this risk is very low when the procedure is performed beyond 11 weeks within 13 weeks of gestation. Current research suggests that there is no increased risk of fetal limb deformities when the procedure is performed beyond 11 weeks of gestation. The patient is advised to call the doctor if in case of fever, heavy bleeding, or severe abdominal cramps. Chorionic-villi sampling. To summarize, this is an invasive prenatal test performed between 11 to 13 weeks of pregnancy to determine if a fetus has chromosomal defects. The test can diagnose conditions such as Down syndrome, but it cannot measure their severity. During chorionic-villi sampling, tiny finger-like projections on the placenta called chorionic-villi are extracted under ultrasound guidance and sent to the lab for analysis. There is a chance for a false positive, a false negative result, or even an indeterminate result. CVS is not recommended in cases of active infection or if the patient is heavily bleeding. Since it is an invasive test, it does carry a small risk of miscarriage. For your benefit, we have this information and more on our website www.chennaiwomen'sclinic.com.